keynote. First talk is a keynote by Dr. Jose Bolaños. He's going to unveil his Nimbus-Key system, which is what his innovation is all about. So Jose has been in the Bay Area, has been a supporter of InnovatorMD, and has been a great physician mentor for many people. He's you're a gynecologist, right, Jose?
Yes, sir. Yeah, I trained at Stanford as an OB/GYN infertility
Stanford,
specialist.
and then he's on the forefront of safeguarding sensitive information in the digital age. A lot of startups forget about the level of security that healthcare information and data needs, and the regulatory climate. Jose will talk a little bit about that and also about his company. Go ahead, Jose. You can
Thank you,
go ahead
sir.
and introduce yourself.
And Yuli, thank you very much. Hello, everybody. This is very exciting to be here at InnovatorMD. I'm Jose Bolaños, MD, CEO, founder, and architect, actually, of this amazing system. It all started many years ago when I created my own electronic medical record system and found that identity verification of patients was a problem. When you did a search and you had 10 Maria Gomez's show up, and all you could, and you had just an ID number, it was a problem. And the EMR systems are with this problem is quite significant, in which all of a sudden you have the difficulty in proper patient record matching, and in the cybersecurity space, the intrusions that are happening. So we have what's called the Nimbus-Key ID platform, the next evolution of secure identity and authentication. So the Nimbus-T Global incorporated is C Corp out of Delaware. We're a startup, been in development for 3.5 years. We provide cutting-edge authentication and identity verification solutions through the Nimbus-Key ID. We provide right now, it's a B2B solution for enterprise systems to issue advanced login keys without passwords to employees. The B2C launch, in which all of a sudden we have to take into consideration patients and things along those lines, we're waiting on that because if a person is 80 years old, they don't want to log in with a mobile phone. We're going to be dueling our system in a static key system in a card. So here on the left, what you wind up seeing is the Nimbus-Key ID mobile app that is on Android and iOS. And when we sign up a company, it's a hospital, or right now, and I'll tell you what we're doing, but it is a secure process in which we truly verify the user. Your iPhone verifies your face and connects it to your username and passwords. We verify that it's you who's logged into your phone, and then we issue a dynamically encrypted identity and a QR code and a PIN, so you don't have to go out to Google Authenticator 10 times a day. So we provide a B2B solution for enterprise systems, right? And the question here is, how is this going to advance the digital world in healthcare? We're moving away from passwords all over because they account for 80% of the system cyber intrusions and attacks. And our hospital systems being attacked? Oh my God, so many hospitals been attacked, and PHI being so personal health information, personal identity information. For example, Change Healthcare, and you all have read about this, and we've been blogging about it. They manage 25% of all the healthcare payments, and they got hacked. And all of a sudden, the payments to doctors and hospitals stopped. They were asking, it was a nightmare. They asked for $10 million in ransomware, or for them, it was even more than that. But in 2023, there were 46 large hospital systems that were attacked. So it was really a big problem. So let me give you an example of what a hospital system has to deal with. Meet John George. He's the IT administrator for a large hospital system. His days are often filled with addressing cybersecurity threats and ensuring the smooth operation of critical medical systems. We're talking about registering patients, taking x-rays, doing all the billing. There's massive systems within this entire enterprise.
Hey, Jose,
Morning, pardon?
your presentation is not moving. Are you moving it?
Right now, no. I'm
Oh,
gonna move in just a second. What
okay,
I'm gonna
just
be able to
checking.
do is put it into perspective. So I appreciate you saying that. So one fateful morning, John's worst nightmare becomes a reality. A sophisticated phishing attack bypassed the hospital's traditional security measures, tricking several employees into unwittingly divulging their credentials. A single username password was at fault, opening access to criminal activity. So all of a sudden, all the systems were encrypted. And what happens? Patients in the emergency room need to be sent out. Doctors that had scheduled surgeries can't operate. Nurses that wanted to deliver medications to their patients can't deliver them. So it's turned into a really big problem. So because the problem is at the front door, the entry point to all systems, that's where we've been focusing on. So as far as our team is concerned, as I said, I'm the founder and CEO. Andrew Snyder's chief medical officer and has been with Mount Sinai in the past. David Decker has been the CIO of United Healthcare. Mohammed Al Joufi, he's a GUA director in the Middle East with us. Philip Abraham, he's a genius. He's with a company called he's the CEO of Brilliancy, which is an AI platform that goes beyond anything you've ever seen. He's got some major contracts with the government and wants to put Nimbus-Key as the entry point to protect the front door. Um, we've got Peter Van Veen, who's the CEO of Van and Healthcare out of the United Kingdom, and we've signed a exclusive right to distribution of the Nimbus-Key system into the UK. And he's going to be he's actually going to be a lead investor in our seed round. Dr. Irving Lowe, he's Chief Medical Officer of Ventura Health Institute. Jared Kaufman, CEO of Premier Surgical. Clay Ballan, who's actually managing all of our IT team. We have 4 full-time engineers and 2 full-time designers. So what we have is here. What we've done is your iPhone does an amazing thing where it is a mathematical equation of your biometric. Your face is connected to all your username and passwords. Apple told me I have to change 620 passwords. A criminal can create an account with your name and a new email, and their iPhone biometric logs them in with those credentials. So that's not good. What we've done is we do a true user verification. Our mobile app truly verifies you, and we have a system with artificial intelligence that then when you log in, not only when you register, it also collects the UUID, the universal ID of your phone, your master PIN. And so these credentials and the verification, we know it's you. And when you log in, we verify that it's you because the image on the biometric goes back to our server. Our AI compares what you registered with. And then our system issues your ID. If you take a 16-digit ID and you encrypt it, it turns into 250 characters. Too big for barcode, too big for magstripe, but not too big for a QR code. So this is a dynamically encrypted identity and a QR code and a dynamic PIN, and those are the keys you use to log in. Our traction, we had our patent issued in 2018. We have 3 registered trademarks, Nimbus-Key, Nimbus-T, and DEMFA. And we've been testing as a surgeon. I don't operate on a patient unless I'm absolutely sure I've covered everything. So it's taken us a little bit longer than expected, but we've encountered things like we had a hospital said, well, wait a minute. So it's kind of cool when you have a laptop because it has a camera and scans your QR code. But we have 1,000 computers that don't have cameras. They're desktop computers. So our team actually created what we call a reverse image logistics that if there is no camera on the computer you're trying to log into, instead it shows a different encrypted QR code that you scan with the camera on the phone. So we call it a mirror image logistic and it connects you in. So let's look at what QR codes are. The entire world in the banking industry is starting to use QR codes, but they're using them in a terrible way. And the FBI is very concerned about the use of QR codes. Here in San Francisco, there was a parking structure that had QR codes, and normally it's just text. For example, there, if you scan that QR code with your phone, it takes you in Info Security magazine on QR code vulnerabilities. So what criminals have done is one QR code looks exactly the same as the other. And so they replace them and send you to the parking structure payment website is now a different website and you're paying to criminals. So it's been a problem. So here, the Nimbus-Key ID has an identity band around it. And if you see that user ID there, John Smith user ID, and then it's encrypted, that's what's in the QR code, not a URL or anything along those lines. And we're also able to protect things like, imagine protecting a social security number or the NPI number. Your NPI number is, 6 digits that everybody knows about. And of the $4.5 trillion in medical transaction fees or payments in healthcare, 25% of it is criminal activity. The government has an NPI, the National Provider Identifier. It's a tax ID number for the healthcare industry. anybody can download the file. It has 1.1 million NPI numbers. So criminals have been given half of the equation for submitting fraudulent claims. So it's a massive problem. So the Nimbus key system is protecting the front end, and we can also protect, like I said, social security numbers, identities, diplomas of universities. So our patent revolves in two verticals. So here is the new login. No more username passwords. Over at Chase Bank, the senior VP said that they're changing the passwords once every 3 months, and it's 16 characters long, and you can't write it anywhere. How can you remember a 16 character password? Crazy. So when we think about authentication, let me just dig into this because this took a lot to understand. The federal government has it confused. So when you think about three factors of authentication, it's what you have, what you know, and who you are. Okay. Now, to the levels of authentication, how extensive it is. Single factor authentication is username and password and security question. Why they ask you 5 security questions, I have no idea. Two-factor authentication adds a PIN that's sent through Google Authenticator or Microsoft Authenticator. And Microsoft's Authenticator just got hacked, and Google's did too. It's sent through text messaging, and it's not encrypted. And then multi-factor authentication, Apple spent $320 million in developing this, and it's pretty snazzy. But it's a mathematical, as I said, mathematical equation of your face that connects to an intermediary ID key that's connected to all your username and passwords. And criminals can create an account with your name on it, and there's no verification. Ours, we truly verified the person. It is your account. We're GDPR in Europe. If a user wants to remove their information, you have to remove it immediately. So we're GDPR compliant. If you want to cancel your account, we cancel it immediately. And it's called DEMFA, Dynamically Encrypted Multi-Factor Authentication. So we are verifying your biometric, the UUID on the phone, the master PIN, and we're issuing a new key that it changes every 5 minutes. So even quantum computing can't decrypt it, and we're protecting the world in a way like nobody else has. So when you connect right now, most of the social media connects with front end. You log in with username and password, or they actually already issue you a key, and these keys can be stolen. They're static keys. And there's something called FIDO2 that's just come about, and it's a static key, and it's causing problems. Microsoft has just aggregated to it. We do what's called SAML2 or OpenID. It's a backend secure connection which you're connecting our system. We're an identity provider with the other system. So we're looking at doing this with Cerner and Epic and all those electronic medical record systems, but there's no passwords. And the digital world, we're talking blockchain has some problems on the front end also with attacks and artificial intelligence. I don't know if you've seen this, but all of the major players that develop the artificial intelligence world are writing letters to the government to actually halt the development because it could destroy our planet. The intelligence has gotten so significant that if you can't control it, it'll actually could create harm, significant harm. So the Nimbus-Key ID system can actually prevent criminals from actually creating AI accounts and inputting false information into those accounts. So there's some very important things that we've been thinking about with regards to protecting the digital world. We're members of x9.org, which is the cybersecurity team in Washington, D.C. And Nimbus-T is on the Federal Reserve's website. The FedNow Fast Pay system is something that was just launched. Bank-to-bank transactions internationally use the ACH or SWIFT network. I don't know if you guys know what that is, but the bank transactions, that is text messaging, so the data fields are different in different countries, and the matching sometimes isn't 100%. It can be 85%, so it's 15% error trying to match the proper data from fields, and it's submitted in text messaging. It's not encrypted. And a payment from Japan to get to the United States takes a total of 4 days and 3 banks. It's not good. The FedNow is using something called ISO 222. It's an encrypted XML data structure. XML data structure, the entire international banking system has all of the data fields now have been defined so that the matching is encrypted, and an international transaction takes 6 seconds. So we're participating in, and we're trying to get hospital systems to participate in the pilot in submitting your healthcare payment transactions through this new network. And the problem in healthcare is not only normally if you have a buyer and seller, or you have a store and you have a person who's purchasing, their banks submit the transaction, so it's a square. But in healthcare, it's like a pyramid. You have a third-party administrator at the top that all of a sudden is telling you what's going to get paid. In this new digital world, we don't need third-party administrators. As a matter of fact, it's going to be quite significant. And right now, the 4.5 trillion in transactions in healthcare, 25% of it is criminal activity. And the employers are spending money on healthcare. We can improve on that dramatically. So this is the future. What we're looking at is if you have medical information in 5 hospitals, we're going to have an AI system that'll be able to aggregate that data. Your Nimbus-Key ID is a global ID that'll connect to all the other IDs and verify that it is you who's connecting to your account at hospital A, B, C, D. So we're looking at banking, blockchain, hospitals, clinics. And on the left-hand side, we've already created a demo of this where the doctor will actually be able to enter your annual exam, your SOAP or short notes, SOAP notes, your complete medical history, past surgeries, illnesses, allergies, medications, providers, and then insurance, all your insurance companies on there. So imagine if you had control of all that, and you go to the doctor's office, you show them the QR code, they scan it, they say, I want to see your medical information. You say, okay. And then all of a sudden, your complete history of all your medical information, AI has actually brought it together and gotten rid of all the duplicates, and you have a master list, and this would deliver healthcare in a totally different way. So this is our cybersecurity blog. You can scan that with your QR code. You can scan the QR code with your phone. What I'm going to do now is I'm going to show you the next slide is a quick demo. This will be 30 seconds. And what's exciting is it's going to show you um, so this is the Nimbus-Key system. And in order to, I'm going to log in here. And the app you only do the facial recognition once every 24 hours. The app stays open for 30 minutes. So if you're a doctor seeing patients, you basically just scan the QR code each time. So right now what you see is I have like quite a number of different connections in here. First, I'm gonna log into my Nimbus account. I'm actually administrator there. So I've logged into this system, and what I'm going to show you now is, let's say you have a company has 10,000 employees with Google Workforce. So this would be the screen that you come into, would have the name of the company, and basically you would be logging, and this is huge because these are big enterprise systems, and to have a secure connection, I've logged in. No passwords, no static keys, dynamic keys every 5 minutes. Quantum computing cannot decrypt them. I have just done something that will change the world in a very big way because now you don't have to worry about passwords. So thank you. If I might have some questions now.
Great presentation. Thank you, Jose. Are you able to hear me okay?
Yes, sir.
All right. There are some questions in the chat. I'm looking at Pawan. Pawan asks, who are Nimbus competitors? Is the goal to use biometrics to authenticate to all apps in a health system?
The main competitors, okay, right now, if you know what's happening in hospitals, they're using RFID cards, and it's a static key on that RFID. So you go in, you touch it, and it logs you in. So when you're in the hospital, the doctor comes in the morning, taps it, then some of them actually said it takes them 30 minutes to log in because they don't have single sign-on. Normally on a single sign-on system, you log in once and then you have the permissions, and on your screen, like in Microsoft Azure Active Directory, you have, oh, I have this here, and you already are accessed it, so you don't have to log in a second time. But what happens with some of these cards, the difficulty, an RFID card has a static key, and some criminal can actually go by and steal the ID and then reuse it. So that's a problem. The major players right now in the identity space, Okta is worth 40 billion. They bought Auth0 for 6 billion. ID.me